Wonderful. Hi, Andrea. How are you?
Hi, Dr. Huntley. I'm doing well. How are you doing today?
I'm good. I'm excited to have you on the podcast. Thank you for joining me and taking some time to share about your journey into public health and about the work that you do. Really excited about that. We were chatting a little bit before, hitting record, and I was telling you about the chaos in my day so far. So I really am looking forward to this time to just kind of settle in and enjoy the conversation. So let's just start at the beginning. Why don't you tell everyone a little bit about yourself?
Sure. Hi, everyone. My name is Andrea Lowe. I own my own consulting business called the Social Impact Studio Consulting. I'm a public health and human services professional, and I also love to read, spend time outdoors, and garden. So it's so nice to meet you all today.
This is fabulous. I get excited always about chatting with my guests and look forward to learning more about you. And I'm going to start with one of my favorite questions, and that's where I get a chance to, and we all do, get a chance to kind of go on, take a step back a little bit and kind of hear about how you got started on this journey and kind of leading us up to what you're doing now. So my first question is, when did you first learn about public health or become interested in public health as a career?
Oh, sure. So it was actually just as I was completing my undergraduate degree. I studied biochemistry at Virginia Tech. My goal was to become a pediatrician, which was one of my probably like three, four different childhood dream jobs that I had. And so I was doing the science track and prepping to like prepare to go to medical school and go become a pediatrician. But then by the time I hit my senior year, I really didn't want to go to medical school. Like the whole concept of like 8, maybe 10 years more of school and residency and all this other stuff. I was just like, oh gosh, like it just sounds so intimidating and I'm tired. So I was kind of like, okay, but I need to figure out something, right? Like I want to do something that supports people's health. I want to do a health related career, but maybe there's something I can do that's not like medical school or nursing school or something that would require that much more education at this point. And so I sat in my college career services office at the time, and they had those big books of different career opportunities or career things that you could choose. This is like not before the internet, but you really didn't turn to
Hmm.
the internet as much for career advice. There wasn't like all that as much information as there's
Yeah.
now. So I was flipping through the book and I learned about public health that way. And it sounded really interesting because it was the whole concept of like helping the entire population be healthy rather than one by one. And I was like, oh, wow, this would be great. Like, I need to get involved with this. And so, as I was doing further research, I saw that you could get your master's degree in public health, and that could be an entry to the field. So, I wound up applying to grad school for my MPH in health policies and programs at University of South Florida, actually, and got in and started my career there.
Nice. Nice. I am always surprised and not surprised. So many guests on the show have talked about their, starting out with the interest in pre-med. I was even interested in that route early on, and then discovering public health. Like, oh yeah, this is it. It feels like home. Like, oh, this is what I was looking for. I just didn't know what to call it. So that's really nice. So let's uh kind of move a little bit to thinking about now. Is there a particular population or issue or public health problem that you find that you're most passionate about now?
Yes, and I appreciate this question because for a long time, I always found it really hard to answer because um, I've had an opportunity to work on like everything from violence prevention to child welfare to food and nutrition in some manner. So I was like, how can I like um, I loved all of it, and I wanted to be able to integrate all of it. And I thought about like, okay, well, what am I most passionate about? And for me, it's really um, community connectedness. And for me, what my biggest public health problem is the absence or kind of this loss of community connectedness, because it really intersects across traditional and non-traditional public health thinking. For me, it's like this recognition of the connection between, like, for example, you and me, between ourselves and our family, our community, our immediate community, as well as the world around us. And it's the connection between like physical, mental, social, and political determinants of health and how it affects everyone. Um, I feel like it's a problem because when we don't have these connections, we can find it easier to like hate or other somebody. We find it easier to like let other people suffer and just kind of see it and like walk by. Or even when it comes to ourselves, we can deal with things and deal with challenges in silence because we don't think that others care, recognize what's going on, or can help us through it. So for me, that's my biggest public health problem. I don't think it's something that I can solve by myself, or it'll probably be something that everyone will have to deal with. We'll have to continue dealing with moving forward as a society. But I that's what I'm most passionate about.
Yeah. That is, I like how you say, you know, we other, people, and then you've explained it really well. It is sometimes we find ourselves doing that. Well, other people can do that, or let them do that. And also when you were talking about that whole just explaining connectedness, and I wrote that down because I like the phrase, the word. Um, it is easy sometimes for us, especially as remote workers. You and I have had this conversation before. We work in our own little bubble, so to speak, and we use this technology like you and I are using video as we're having this conversation, and it does help us to feel more connected. It is too easy for us to really feel very isolated and very alone. And then that amplifies the problems or the challenges that naturally come up. It feels very overwhelming when we stay kind of to ourselves with whatever it is that we're dealing with. And that lack of connectedness that, fosters that kind of negative spiral. Been there. I understand it. It definitely happens. And I try my best to kind of break that in my own kind of cycle and then with other people as well, especially in the community of public health professionals, entrepreneurs, and so forth. So
Mm-hmm. Mm-hmm.
very nice. So let's talk a little bit more about your business. Tell us, the name and who you serve, and describe like your ideal customers or clients.
Sure. So I run Social Impact Studio Consulting LLC. I started that in August 2022 with a move to Central Pennsylvania. So I'm based out of a small town in Pennsylvania, and I primarily serve small to medium sized nonprofits, government agencies in the public health and human services sector. So ideally, they're organizations who are either like just getting started, thinking of like nonprofits who are just getting started, or organizations that have been established for a long time and they're just looking to change things up. I'd love to like work with them to review their service array, really make sure that they're meeting the needs of their communities and clients, as well as dreaming up new ways of addressing the problems that they're facing each day, and kind of like working collaboratively with the community, so that the people that they serve are truly getting the services that they need to sustain and improve their lives.
Yeah. So that I like how you describe that too, especially being able to say the small to medium nonprofits, and kind of explaining why. And they do have a certain kind of quality. So when you're helping them with their programs and services and so forth, is it the the back to the connectedness that you were talking about, helping them to connect with the community, individuals in the community? Can you tell me a little bit more about how you work with them?
Sure. So it can be, so I feel like community connectedness kind of serves as a foundation. So it may not be like the direct connection with their community. They could already have like really strong relationships with their community, which is great. But kind of like, how are you taking that relationship and making sure it's primary and servicing everything and guiding everything that you're doing? So for me, I find that through I guess what we call like strategic planning. So I kind of see it through participating in the entire or parts of the life cycle. So that can be developing the strategic plan in partnership with the community and the organization. It can be doing policy development, policy review, or just helping them as they start up programs or thinking through how can we really create this program to build and or maintain our community connectedness.
Yeah, I get it. I definitely understand that. And that is, I mean, I know we're on the same camp. So as public health professionals, it's like, oh, I definitely understand it. Do you find that your clients see that as a problem? Like you're especially the type of nonprofit where they're, just getting started, thinking, are they kind of aware that they have, this kind of disconnect or they need help here? Or like, how does it show up for them?
I think when it from the ones that I've worked with so far, they've recognized it's a problem. Like so, for example, like they want to reach out to this particular group, but they haven't had that connection with them in the past, or they want to, um, or maybe it was not a great connection just by nature of like them just doing all the things.
All right.
So helping like I work with them to strategize about how you can go about building the connection and like what it would mean and what you might need to change about your operations and how you're performing services to really build and sustain that connection because sometimes it can be just the way that we're working isn't very welcoming to people to participate in it.
Yeah. Yeah. Well, thank you for diving in a little bit deeper with that. It's very helpful. I know that we have a very diverse audience of listeners. So you may have folks who are leading these small and medium nonprofit organizations who are listening and thinking, oh, maybe I need to reach out to her. So that is something, we'll provide information in the show notes where people can connect with you. But I just wanted to make sure that our listeners understood really how you're helping and how you're supporting these organizations. So that's great. So let's talk a little bit. So that kind of I kind of lumped in some of my next question. I was going to ask you about the products and services, but I will ask kind of a little bit more about that. In terms of products and services, is there a particular type of service or product that you're offering?
Sure. So diving a little deeper into what I was saying earlier was like I kind of look at it as like um, participating in the strategic planning life cycle, and I see it in three kind of aspects of that. And one is the actual development of the strategic plan, including revisiting mission and vision if need be, um, helping set priorities and plan for the next few years, and that can be within two phases, one that's more internal, thinking about your operational policies, whether they're actually written in stone or just how you actually are performing your services, like reviewing them, talking to community and clients. Are you set up to actually meet their needs? Are you meeting their needs? Is it effective? Those kind of things. And then the second part of that policy development can be more external policies. So, like, let's say you already have a well developed strategy, but you recognize there's maybe some legislative or barriers to implementing that policy. So, working with you to develop a policy agenda based on your resources, your supports, and how you can incorporate the community in to serve as your advocates to make the legislative changes that you need to be able to do what you need. And then the third phase of the strategic planning lifecycle that I participate in is the program management and development. So perhaps an organization needs some temporary or part-time program support because they're either starting up a program, maybe through that strategic planning process, you have this new innovative thing and you need to get it off the ground and you just don't have the right person on board yet. I can help with that. Maybe someone's on parental leave. My first contract was actually supporting an organization where someone was on parental leave. So I was just there for like 3 or 4 months and kind of kept things going. Or just supporting organizations who may need some backbone support for their community-led efforts as well.
That I like the framework there, the strategic planning life cycle, and the way you've described it makes it very easy to understand. And it really, I love that feeling of I guess in a sense completion. It doesn't mean that you help them with everything, but you have a
Mhm.
very clear like place you can come in and a point you can get them to. If maybe all of those components may get them to the next step, which is a huge win. And um, so I really like that framework. Awesome there. So this is where I'm going to transition a little bit into, I call it connecting the dots. I think that in my experience in podcasting, as public health professionals, we can kind of stay in a little bit of a bubble in a sense that we talk our own language and we understand each other. And then sometimes we don't even understand some of the phrases like epidemiology really well. The field of public health is very broad, so it makes it sometimes a little difficult to have a one size fits all definition for most things. And with so many people outside of public health that are now curious and trying to understand public health, I like this little segment where we can connect the dots and kind of use our own words and experiences to explain some phrases. So with that in mind, I have two questions for you. I'll start with the first one. And this is just in your own words and in your experience, as it relates to you. But how has the understanding of public health helped you better serve your clients and community and, have a greater impact?
Great question. So I feel like for public health, it provides this like global systems approach to addressing problems, not just health like our traditional health problems, but I think even non-traditional health problems. So for me, I think it helps me better serve my community, serve my clients because I'm constantly thinking about, constantly asking like, what aspects are we not considering that are important? What are the overall optics of our potential solutions? What is the impact of our solutions? And what could our wider impact be? How far back in the system? Who else is involved in this process? And how far back in the system do we need to go? So, with this approach, I have the opportunity to think through the different alternatives as objectively as I can, be able to bring in, encourage support from partners and stakeholders, even ones that may not have typically been at the table, and work with others to recognize and appreciate like this opportunity to like stop, reflect, see all the connections that we possibly can, and before we jump in to address the solutions.
That's wonderful. Um, I really like that. And sort of in that same context, how has the understanding of epidemiology helped you better serve your clients and community and have a greater impact as well?
Think for that question, like for me, I have to take like epidemiology down to its core because I feel like I don't see myself as an epidemiologist. And if anyone passed me on the street and was like, "Oh, do you do epidemiology?" I'd probably be like, "No, I don't. I don't." There's I haven't touched that in a long time, but but like for me, like kind of breaking it down to like, okay, if epidemiology is really just like understanding and assessing data to drive decision making when it comes to health, then yes, I do that. And I understand it, I practice it, because I think data is so critical, and that can be all sorts of data. So it can be our statistics on like the rates of cardiovascular disease, the rates of diabetes, obesity, but then also it can be just talking to my community members and asking like, okay, well, what's the asset in your community? What's the challenges in your communities? How can we address it together? What solutions do you see? And so I feel like um, being able to capture all that data helps me better serve my clients because it using this data to drive can drive the effectiveness of strategic planning efforts so that our decision making is truly just based on the evidence that's around us. So I like to work to gather as much information as possible from as many different sectors, many different groups and types to get that fuller picture.
Oh yeah. That's really well said. I like the way um you were to break that down. I love hearing responses to these questions um I really love your response. So let's see. We have a pretty diverse audience of listeners of the podcast. So, is there a bit of advice or a tip that you would give someone who may be interested in working in your industry or niche?
Sure. So this actually relates to my passion for community connectedness. And my bit of advice is that you do not have to go it alone. And this is something that I learn and I relearn like every day because I'm personally very quiet. I'm a private person. So it is a stretch for me to be vulnerable, to be open to people. Even doing this is honestly outside my comfort zone. But but you know what? I recognize that like my professional career, my personal volunteer experiences, my personal experiences in general have only been enriched because of the people that have helped me get to these places, people that make up those places and experiences. That's what is like the heartbeat to my life, and so I just want to recommend and that people reach out for help, reach out for advice if they need it. Recognize when they need it. I'm thinking of like, let's say if uh, you're interested in a job or interested in a career, you see a leader that you're really interested in, connect with them on LinkedIn and try to say something to them. Sometimes it comes out to nothing. I've had people never answer my messages, but sometimes people do answer, and you wind up making a really good connection and meeting, and you never know how other people could help you or how you could help other people. So just that would be my piece of advice is really just recognizing you don't have to go it alone.
Yeah, that's a great advice. I love every bit of that. This also kind of reminds me of, um, you attended our expo earlier this year in Orlando, and which we had such a great time. It was such a wonderful experience. And I remembered, I'm just remembering this, but you were celebrating your birthday
Yes.
while we're there. So we built such a community, such connections in that time. We, sang happy birthday to you. And I was so surprised because, first of all, I think we had so much talent in that room. The first time out, the singing was great. Like there was, it was,
Yeah.
it was harmonizing. It was so good. And I'm glad that, we got a recording of it because I've watched that little video so many times and it makes me smile. But I thought about that as you were explaining, kind of this connectedness. Everyone, like some people knew each other, right? But a lot of folks made the decision to come to Orlando for the first time. People traveled from all over, and to walk into a room when you don't know any, if you even have friends in that room or any other people that you already know, but just like into a room of strangers, in a setting like that, and choosing to be a little vulnerable and opening up. It kind of, as you were explaining a lot of these examples of connectedness, it reminded me of that event. And like, because everyone made that decision to do that, so many, relationships, experiences, were a great result of that. So, um, it just made me think about it.
Yeah, no, that was such a great event, and it was honestly, I was really nervous kind of coming in because I knew I hadn't met anybody in person and just kind of communicated a little bit online through the groups up until that point. But I really, I really loved connecting with everyone. It was such a great group, and just recognizing everyone had that same goal and interest in mind to build our entrepreneurship skills, I think that just helped us to connect further.
Yeah.
And I appreciated that space, and being there, even though it was my birthday, just
Yeah.
really being there with everyone too.
Yeah, and it's and now that I understand your passion in this way and how this could spill over into the work that you do and connect in your clients and the community work, it just it makes so much sense. You took that, you chose to be a little uncomfortable and to make that step for the reward. So I imagine that, in this example that I'm sharing, and because I was there and I watched you, now that I understand your passion for this and in the professional sense, I really can see how valuable this is for those organizations, especially those smaller not or medium nonprofits. Like you said, a lot of times they're just getting started. They're going to need that kind of guidance and support as they build those connections. So it really helped me to understand, the greater impact in what you do, because I've seen it in different from different perspectives. Yeah. Well, I've enjoyed our conversation and getting to know you a bit better and hearing more about your business and what you do. As we wrap up, now I'm going to provide links to connect with you in the show notes, and I'll share with everyone in just a moment how to find the show notes. But just as a final question, what is the best way for our listeners to connect with you?
Sure. So they can reach out to me via my website is socialimpact.studio. There's a contact us button at the bottom, and they can just submit a little message, and it comes straight to me, and I'll have an opportunity to connect with them.
Perfect. That is wonderful. And again, I'll tell you how to get to the show notes in just a moment. But for right now, Andrea, I really appreciate you taking some time and being here in the conversation and the little trek down memory lane to remember some of the fun things about our Orlando Expo experience as well. So I appreciate you.
Thank you. Thank you so much for having me.